Health Organization is working with scientists across the globe on at least 20 different coronavirus vaccines, with some already in clinical trials in record time, just 60 days after sequencing the gene. The acceleration of this process is really truly dramatic in terms of what we're able to do, building on work that started with SARS, that started with MERS, and now is being used for COVID-19. The vaccines are still a long way away from being available for public use, WHO officials cautioned. Leading scientists say the clinical trials and safety approvals needed to get a workable vaccine to market could take up to 18 months. Dr. Mike Ryan, executive director of WHO's Emergencies Program, said the trials are necessary. There's only one thing more dangerous than a bad virus, and that's a bad vaccine, he said. We have to be very, very, very careful in developing any product that we're going to inject into potentially most of the world's population, he said, adding that the first human trials on a vaccine that started this week in the US were unprecedented in speed. He said that would have never happened if China and other countries hadn't shared the genetic sequence of COVID-19 with the rest of the world. Once a vaccine is found, WHO officials warned about other logistical, financial and ethical hurdles world leaders will face. Even if we get a vaccine that's effective, we have to have that vaccine that's available for everybody. There has to be fair and equitable access to that vaccine for everybody, Ryan said, adding the world won't be protected from the coronavirus unless everybody is vaccinated. How do we ensure we get enough of that vaccine in time? How do we ensure we can distribute that vaccine to populations all over the world, and how do we convince people to take the vaccine?